Welcome to TeqTalk. I'm your host, Jas Kaur, and today's episode is going to be a practical deep dive into public healthcare IT. And I'm joined by someone who has not only led massive transformations, but has made it really look possible under pressure. Welcoming Khalid Turk, the Chief Healthcare Infotech Officer at County of Santa Clara. Thank you so much, Khalid, for joining the show. Really appreciate your time.
Thank you. Pleasure being here.
Yeah. So let's start by grounding this conversation. A CIO role in public healthcare, it sounds really huge and complex. So what does a typical day look to you? I mean, how your day starts and what do you end with?
Sure. There's no doubt that the CIO role in public sector is very different than the private sector. And every sector has their own challenges. I wouldn't say that one is better or like more challenging than the other. Challenges are different. Mm-hmm. Typically, what we deal with, depending where you are and what kind of services you're providing, is that we have to do more with less resources.
Yeah.
The growth of the business continues on. The growth of services, in our case, continues on. But at the same time, the resources don't pace at the same speed. So that is the challenge that is typical for a public sector CIO. And we generally have, like any other CIO, a strategy, a long-term strategy, and also short-term strategy sometimes, which is driven from the long-term strategy, which is generally 3 years. So we have a roadmap plan that we stay on. But like life, things happen, and that defines a day in the life of CIO. I always tell this jokingly at the conferences and other opportunities where I go to speak. I quote this from one of the boxers, and he used to say that everybody has a plan until they are punched in the face. What does it mean that, you come with a plan, this is how I'm going to do, this is how I'm going to run my day, and you'll be punch coming in your face, and then every plan goes out of the window, and you are just throwing your arms and punches at the problem. Mm-hmm. So what happens that, generally speaking, you will come like any other person. For CIOs or any executive leaders in the public sector, the life is not 9 to 5 or 6 or whatever you call it. We are essentially available directly or indirectly 24/7, literally. And what does it mean that you have to be accessible because the problem may arise anytime. But on good days, you start very early in the morning, check your emails, check your calendar if you did not do it last night or previous night, and then carry forward with your day until life throws punches at you. And when that does happen, for example, there'll be some security issue or some human resources issue or something else going on. A vendor has a problem or some project timeline is being missing. Then you have to make sure that you get from the strategic to the tactical mode and try to address the risk that just came up. So from that aspect, I believe the public sector CIO's life is not any different than the private sector CIO. So we deal with the problems as they come, but generally speaking, we have pretty good idea that what is going to happen in months and sometimes in years, even though years are far away, but for months we can plan ahead.
Great. Very, very well said. And I think it must be very busier for you as well, because I have seen that it's apart from your CIO work, you have taken numerous initiatives. You're pretty active on LinkedIn. You're pretty active socially as well, spreading like education everywhere and a lot of information everywhere. And we will be talking about some of them. So let's right now talk about mission driven, right? You have spoken somewhere or written somewhere that you are a mission person. So that is very, very powerful. And I would love to hear some of the stories from your end that has shown up in your daily decisions. So like how you mentioned, whether choosing a vendor or, allocating any budget or responding to any crisis or security breaches or anything. How do you drive all of these?
That's right. I'm part of the County of Santa Clara, a workforce of little over 23,000 people. And we all come together every day to make sure that services that our citizens need, they could be provided. And those services range from not just the information technology, but from the public safety and justice and recreation, social services.
Yeah.
And there are multiple agencies in the county that provide services to 2 million of our residents. Mm-hmm. And many of them cannot survive literally without services of the county. So that in itself brings a purpose to our life, to our day. And that's what makes us, the 23,000 employees of this county, that we have a purpose in our jobs, in the work that we do. And county's mission is obviously to provide the best care in every sector to our residents. I am at personal level responsible for the information technology for our healthcare. Our healthcare system is one of the largest public sector system in America and second largest in California. So we have multiple hospitals, 4 of them actually clinics, behavioral health, public health. So every day we provide services to hundreds of thousands of people from the different aspects. And that definitely brings a purpose and drives us to the best on our constituents. So happens that we live in one of the most affluent areas, geographical location of the world, I would say. But at the same time, the reality is that the population that we have in this particular county is that many of them will not be able to afford the healthcare services or the social services, childcare services, and whatnot. That's where we come in. We make sure we means here the technology department enable the frontline workers, be on the healthcare side, public safety side, or services side, that they have tools and technology and processes available. So take care of the masses. So that's where another mission comes in, that we make sure that our public safety related systems, our healthcare systems, they are available 24/7 because health does not sleep in the night. So is the public sector. So we ensure that work that we do in IT from the availability perspective, from the security perspective, it's always there and it's always secure. So these are some of the aspects that drive us every day, the 23,000 strong county that takes the 2 million residents here in California.
Yeah, great cause. And serving people is one of the biggest drives, right? That drives the motivation to just perform the best. And since this healthcare industry is pretty sensitive as well, so there are a lot of factors to be considered. Whenever I talk to CIOs or, CXO level people, so we deep dive into what kind of complexities they face, what are the current challenges they have in the industry. So from your vantage point, I would also like to understand and know more about the current challenges you see in your sector. I'm pretty sure that there a lot have been improved or enhanced from a couple of years, but still, what are the biggest 3 challenges, if I can ask you, in your organization?
Yeah, that's an interesting question because challenges are more than 3, as you would envision. So what are the top 3 challenges? Let's get to there. In order to understand my answer, let's understand the context here, that how the government works. We know we are federal government that takes care of many of the needs of the masses and citizens living in America.
Right.
I'm only talking about the government in America. And a lot of work happens through the states. And the states, their governments, their own rules and regulations. So the federal government provides funds to states. And the states provides funds to counties like ours, County of Santa Clara. And County of Santa Clara will run multiple services on the behalf of the state. For example, healthcare services, public safety, social services. I'll just hone it on the health system. Health system side, as I was saying, that we are one of the largest counties. So we have 4 hospitals. We have multiple clinics, behavioral health, public health. They all work for different needs and cater to different needs.
Yeah.
We are not for profit. But in order to continue to provide services, we have to make sure that we have revenue available. So our revenue is coming through federal government, the revenue is coming through state government, and there are some other revenue generating opportunities within the hospital or generally speaking in the county that can counter for that. So one of the major challenges, especially in the current environment, is having access to the right resources in terms of budget, be it a federal budget, be it a state budget, and even at the county resources or revenue that we can generate. So healthcare as a whole in the country, there are things happening. The cost is increasing exponentially, and revenue is not catching up. Anybody that follows the healthcare, they will notice that every year 5 to 10 hospitals are closed in America. The reason being that they could not stay solvent because their expenses exceeded their revenues, and whatever they tried to do to meet the gap and even tap into some of the resources that state and federal government provide, they could not make the ends meet, and those hospitals had to be closed. And every time a hospital get closed, patients don't disappear. Those patients will be going to other resources. So in other words, when we are drawing some of the resources of healthcare, we are overburdening other resources. So suddenly flux of patients into different ER departments. If, say, hospital in our neighborhoods gets closed, our hospital will get that load of most likely of that patient. So that is a challenge. And that challenge in the environment where the funds are drying up and rather speedily, that becomes a challenge. One of the biggest challenge that is coming our way this year is the new federal budget. Still needs to be approved, but the way it seems right now, there will be a major cut in the Medicaid. I want to explain for the viewers that government is the largest insurer in America. They provide insurance and through two different categories. One of them is Medicare, which is what us all pay towards. And when we retired, we get the benefits, not to the 100%, but around 80%. So that is Medicare. Medicaid is insurance provided mostly through the federal government and through federal government to the states. And it's a partnership between the state and the federal government. And depending on the state, it is defined that how much funds will be coming from federal government versus the state government. And in the current budget scenario, it's very likely that Medicaid budget will get reduced by significant. The current budget numbers, I believe, are around $700 billion per year. And that means that California will be getting less of the funds and support, which means that county will be getting less, which means that we have to find ways to continue to take care of our patients. That is going to be a biggest challenge that is going to further define other challenges, which means that we will have less of resources to take care of the similar or even larger population of patients. The larger, because I say that I do foresee that some of the hospitals may not be able to survive in this current environment. And that has been going on. One of the reasons for that trend is that cost in healthcare is by the labor cost. On one end, we have shortage of resources, which is definitely one of the challenges as we're talking about three biggest challenges. And the other one is that cost of that labor. I believe healthcare is the only industry where the labor cost is more than 50%, around 60% to be exact. So which means that for everything else that we do, which is your medication, which is equipment, which is the buildings and whatnot, the whole infrastructure is only 40%. Basically, the close to 60% of the cost is going to the wages. What does it mean? That we have already a limited amount of funds to work with. And if this well gets dried down, which is Medicaid, it's going to impact the industry really poorly, which means that some of the services will be closed down. Some of the even institutes might not exist in the near future. So these are the key challenges. But at the surface level, the challenges are, I'm talking about in the tech terms and also human terms, the resource burnout, both on the IT side and also on the provider side, is one of the major issue. And that has been going on since COVID. People overworked, but that work is not going away. So one of the downside of getting the resources where you have a labor shortage, labor is too expensive, and then the fund shrinking, what is happening that we will ask these resources continue to do more and more because the patient population is not shrinking. And until that happens, it means that we are overburdening our staff, be it healthcare providers or the IT providers. And that is going to be a major issue in the coming days and weeks and months.
Yeah, that's very well said. And it is so hard, right? It's so tough to see that from both the sides, there are crunches and still the service need to be provided in there is no compromise on the services end to end, but with very, very limited resources. So I'm just wondering that where comes the scope of innovations now? It's very hard, right? Even to think about innovation. First of all, you have to suffice with the basic necessities and basic services, right? Once the budgeting is done, you have people from the provider side. And then you also have to think about innovations, that what all we have been talking about AI in healthcare and different private sector and different other industry. Do you still have the budget of innovations like 20% or 10% or 5% which you invest on, or you foresee that, okay, this kind of innovation is really going to make impact and let's go ahead and do this? So how do you take decisions on that?
I love this question and makes me think and collect my thoughts in this one. But there's so much information I want to like blurb out on this one. So blurt out rather. So I will see that how I can address this particular question from different angles. So generally speaking, not healthcare industry or my job, the issue of innovation is general with the IT, not in healthcare, not in county. Recently, I was reading a report probably from McKinsey, and if you Google it, you'll find it too, that for the healthy economy or healthy tech sector, the innovation budget should be about at least 25%. But in the finance industry in America, and finance industry is supposed to be on the cutting edge. I mean, I'll speak about that slightly. We are lagging the curve than leading the curve, and there are reasons for that. But financial industry needs to be on the top of the curve because there's a lot of innovation happening and the element of risk is lower than the healthcare. Healthcare historically has been risk averse, and that's the reason because we are in the business of saving lives.
Exactly.
A small mistake can cost someone their life, and one life lost is one too many. So there is no room sometimes for a mistake. That's why we will be the last one to adopt to a technology which is not properly tested and tried. But coming back, drawing the parallels, even in the finance industry, and this is a known research, I believe large organizations spend like 7 to 10% of their budget to innovation, and where the good amount is like 25%, 90% of their budgets, 80 to 90% goes to the keeping the lights on. We know this term, keeping the lights on, which is what money you need just to keep your current state of infrastructure
going here,
so that they are running. And that is problem. I just drew a parallel with the finance industry. Similarly, in healthcare, we have been installing systems for past 30 years, more than 30, but I'll say last part 30 years, where a lot of significant innovations and improvements in technology have happened. Yeah. So we have a huge technical debt in this industry too, like many other industries. So every given year, we need X number of dollars, depending upon the age of our infrastructure and the mix of our applications and age of the applications. App rationalization has not happened in years. So we have been keeping on old systems and then piling up more and more over a period of time. I was involved in one project where we had some OSs that were like 20 years old. No kidding there. The network was like Cat 2 or Cat 3, like way old, not even Cat 5, which is like antiquated now. So the point being that when you are dealing with that legacy, with that technical debt, you make sure that you continue to save the lives, which is your primary mandate. Healthcare innovation is not your primary mandate. Innovation, the primary mandate is to make sure that you take care of patients and keep them well, and to the best intent possible, prevent them from coming back. While we are doing that, and we have this legacy, and these resources are squeezing, the importance of innovation has never been higher in the history. Luckily, we are living in times where we have a hope in terms of AI in different ways. AI has been there for 20, 30 years in some useful form, in theory, longer than that. But with the generative AI in past 3 to 4 years, we are seeing a lot of opportunities in innovating more, automating. Automation is also an old concept, nothing new. But where I see a lot of promise is the automation with the help of AI or AI-enabled automation, because they will be, to some extent, if we can take the human out of the loop, that's where the more efficiencies could be gained.
Mhm.
But again, being in healthcare, we have to make sure that our primary focus continues to stay on the human. So when we look at the innovations, they have to be implemented in a way that make our providers more efficient, reduce their burnout, improve our processes of taking care of the patients,
Mhm.
intake all the way to the generation of the revenue and any follow-up communications or after visit communication that needs to happen with the patient. But at the same time, we have to make sure that how we can deal with the current challenges we have in the technology, which is that many organizations have systems that have not upgraded in years.
Yeah.
So to your last part of the question, how we are dealing with, we have a very comprehensive strategy in place where one of the tenet of the strategy is to modernization of the infrastructure and modernization. This other one is business systems. So we have to make sure that we continue to reduce our technical debt, and be it in the infrastructure or be it in the applications. We are working on app rationalization, making sure that we can consolidate our portfolio, reduce some of the old systems. And on top of that, we continue to introduce new technology in terms of AI. One thing that I'm very particular about, this is like my calling, that I don't want to be part of creating the technical debt of future. What I mean, in a typical healthcare industry, they have this core system. In finance and manufacturing, you hear the term ERP all the time. In healthcare, you will hear the word EMR as many times, which is electronic medical record. Every healthcare organization uses EMR. And EMR have some native functionalities, and some of them, even they are coming from some of the leading firms. They are rooted in some native technology that was slightly older. So it not, I would say, naturally lend itself to the modern technology of AI. So essentially what they are doing, they are mandating their technology by adding layers. Really, there are so many products, so many players available, and every organization in a run to innovate and create efficiencies, they are buying multiple products. It seems like we are getting back to the wild west of 90s and early 2000s, where there were so many products and they had so many promise, but that promise at that time was not truly tested until dot-com bust happened, and then the Web 2 brought some new promises. So AI is still in infancy. I personally believe it has promise. It's going to make so many lives easier. It will also put so many of us out of our jobs, the current jobs that we are doing. But it must be implemented with utmost care, that we do not create the technical debt of future in the name of innovation.
Yeah, right. And I really love the point which you mentioned, that the primary focus of any healthcare should be on providing the services, making sure the patients are treated well, and the revisits to be reduced, instead of just focusing on AI blindly without getting the futuristic ROI. So let's deep dive into some of the great innovations and projects you have led. And one of them, which we have read, which is available in your LinkedIn as well, is like 90 days hospital integration. So tell me more about it, how it went, what all integrations were there. 90 days seem to be very less. So typically organizations, take over an year for even small integrations, right? So I would like to know about it. Seems to be very, very interesting.
Yeah, that topic excites me and makes me proud of the organization I work with and work for. Must say that it was all hands on tech effort. And when I say all hands on tech, it's 23,000 employees of County of Santa Clara and their leaders and our elected board of supervisors coming together to make it happen. Because we had support at every level, from peers, from our teams. I'm so honored and lucky to lead a stellar team of about 260 people, and almost everyone was involved in this effort. But every time we had any challenges, be it with procurement of goods and services, with the contracting with the vendors, and any other operational issues, from the operational leadership to the county leadership to my peers in the county IT department. We all came together to make it happen. How a project of this size could be done in less than 90 days? I believe that experience and alignment plays very important roles. We at county have done similar challenges or dealt with similar challenges before. In 2018, our county acquired 2 hospitals, O'Connor and St. Louis, immersed them in less than 6 months in our system, which was unheard of over there. So that experience and alignment and coordination among different departments, a lot of learnings were had there. And we had documented that a typical project management office would do. We brought them together and put a stellar team together, both from operational side and from the technology side, to work very, very closely. We at the technology team have a very strong project management culture. Every year, we release multiple projects. And by the way, during the pandemic, we did more than 100 projects in less than a year and big and so even with the smaller capacity we have, because we can be flexible and we have skills in-house. When we don't, we bring in skills from outside, and the top leadership makes sure that we have resources we need, be it in terms of monetary resources or human resources. So everybody came together to make it happen, but it was a coordination and alignment at multiple levels, top leadership level, hospital operation, and our teams at every level came together to make it happen. But I'll tell you the other side. Earlier, you were asking about the mission driven. Why we are not in the business of making money. So why even we are acquiring a hospital? It is required of us as the county to take care of our population. So one hospital that we acquired, the last one, the Regional Medical Center, it was privately owned, and privately owned obviously have different drivers to continue to do the business than public sector does. And many of the services were not profitable in this hospital, and they closed down, like the stroke service, the STEMI service, which is related to heart attacks, and women and children related services, because they were not profitable. For us, it was required, and as the service provider or a public service provider, to own that hospital and continue to provide those services. So tying that together to how the mission comes in, on April 1st, we went live, right? In less than 90 days, actually. And within 12 hours of opening, 2 emergencies that came in. One was for the stroke, one was for the STEMI. These were the services that did not run before us acquiring that. And our staff, the wonderful staff we have, was able to save both of those lives.
Wow, that's commendable.
Services were not available there. It's anybody's guess what could have happened, because when somebody's having a heart attack or they are having a stroke, every second is important. So they could have been driven at least 30 minutes far away. So we saved the time, and our staff was able to, and care providers, take care of them. And that brought us joy. Even working for hours that time, my team were there for more than 24 hours because it's a typical go live. But we didn't feel tired when we saw that our efforts have come together to save human lives. And that continues. I'm just telling you a story of first 24 hours. So many more lives have been saved that. And that's where the mission comes from.
Wow, that's such a great cause. And I think if everyone starts thinking like this, and especially the leaders of healthcare, we definitely will have much more better healthcare system across. So tell me more about Epic EHR, which has been rolled out in your system, and the implementation across different diverse entities like hospitals, behavioral health clinics. So integration of all those through Epic EHR. So any information would be helpful.
Yeah, in order to understand and appreciate EHR, it's important to understand the workflow of a healthcare.
Yeah.
We as a consumers, and all of us at one point in time have seen a doctor. Healthcare has the whole healthcare industry value chain, but if you bring it down to a typical day in a life of a patient or a provider, what does actually happen? Essentially, if somebody needs a healthcare, need to be taken care of from a healthcare provider, They will make an appointment. They will show up. Somebody will see them. Somebody will document that.
Yeah.
And those patients will, if they are outpatient, they will leave. They will collect medication. They might go to lab to get their lab done. They might go to radiology to get their radiology done, whatever the need be. In the end, the documentation about that visit needs to be completed, which generates a charge that somebody has to pay there, that cost for that. For that, we have payers. And eventually a claim is sent out, and claim is accepted or rejected. If it comes rejected, it comes back for correction. If not, it's eventually paid. That is the whole life cycle of one episode or one encounter in the healthcare.
Yeah.
And historically, these steps were handled in different electronic systems. And then come the EMR, electronic medical record. The vision here was that, whatever steps are involved in that whole process that I just described should be managed in one system. And let's call it electronic medical record, or some companies actually call it electronic health record. These terms are used interchangeably. And even many people actually in the industry, in the tech industry, know ERP better than EMR. But now you see that how you can relate it to the ERP, even though hospitals and healthcare systems and county use ERP too, but that's like the closest analogy that I can draw. So EMRs were invented and they were utilized in the organization, which were like forward looking. In California, I believe the oldest EMR was implemented in El Camino Hospital, that is here in the Bay Area. And that was, if I'm correct, was produced by General Dynamics. So they were in the missile business, but somehow they went to the software and gave to them. But that was like early days of 60s and 70s. Eventually, I'll just move fast forward that how these EMRs became common. Because in one way, they help the organizations to automate their process to some extent, if not even automate, streamline their processes, and provide some additional services to the patients.
Yep.
At the same time, they overburden the care providers. In the old times, even if they were the paper chart, a patient will come, doctor will look at them, take care of them, and then write some documentation, and the documents will reside somewhere. So the bills could be generated and whatnot. With electronic systems, there was a burden on the providers to continue to document in a proper, certain way that in the end generates revenue for the organization, because people need to be paid, right? So in this context, we also need to understand how the healthcare industry works. In the healthcare industry, there are three important corners of that. One is a patient, which is a sick person needing help. One is a provider, which is the person who takes care of them, or an entity that takes care of them. And there's a payer. That payer takes care of the money part of that. And patients generally go to the payer, get insurance, and when they take care, the care provider gets money from the insurance. That's how the cycle works. And they are constrained in a circle, which is like regulations that come from federal and state government. That's how the system is working. Yeah. So coming back to our original topic of EMRs, fast forward to 2008, under the Affordable Care Act, also known as Obamacare, they introduced this feature called meaningful use. And meaningful use encouraged the care providers to utilize electronic medical records to create documentation and the track of the healthcare in a certain way. And at 2008, the utilization of EMRs in healthcare was roughly around 37%, somewhere there. But since then till 2020, it increased to 90+%, because the Affordable Care Health was accelerated. Because if the provider were not using that, they were leaving the revenue on the table. So they were, and that's how the EMRs came. How does it apply to us? For our organization, we implemented our EMR system from a vendor, and very famous vendor called Epic System, in 2013. We started the work in late 2011, 2012, and implemented in 2013. And that was a wave that everybody was going on that one. But what it did, it replaced multiple old systems. For example, historically, I was telling you that for the appointment, there used to be a different system. I used to work many years ago. There used to be appointment system. There should be a patient registration system. The documentation system did not exist, but there was some information, rather the revenue cycle system that used to work in the back end. So practice management system. So they all were consolidated in one system. And then we have been continuing to strengthen it, to add more components, like there'll be component for lab, for pharmacy, for radiology, and every department in the hospital. So this EMR is a suite of product. In our case, it's Epic EMR. That is utilized by most of the healthcare organizations, definitely in California and across the country. If I name the hospitals across me over here, be it Stanford, Sutter, Kaiser, everybody uses Epic system.
Yeah. All right. Thank you for that. And talking about healthcare system, we know that one of the key pillars in any healthcare system is interoperability. So how do you handle that? Do you think that there is still any silos of data which you maybe in future will integrate and make it data warehouse or, common place or one place from where the data is extracted? Or you think this is not the time to think about it? There are a lot of multiple small silo system and can be taken some time in the future.
No, actually, things have been much better of late. Where we started, and I've been doing this interfacing since 2004 when I was at Kaiser Permanente. And the technology that we had then versus technology now, it's, I would say, day and night difference. So there are still challenges with interoperability, but the technology and the operations and the systems connectivity has definitely improved. I'll tell you where the challenge is. As I was mentioning earlier, before EMRs, there were multiple systems for like each piece of the process or a value chain was utilizing their own software and they needed to talk with each other. But with EMR, like Epic or even Cerner, when we implemented, many of the functions that were done by disparate systems were combined in one system. So the dependency reduced to a certain extent, but not fully, because in healthcare ecosystem, pharmacy could be using multiple systems.
Right.
Radiology, cardiology, I can name any system. And those systems have to communicate with even with your EMR. In my shop here, we have over 350 interfaces. So we are using Epic. You might ask, why you need interfaces? Because everything is in Epic. Yes, everything is in Epic. But the lab instruments that actually process the specimen and generate the results, they need to talk with your EMR.
Right.
So all your modalities. Modality is a device that, say, takes X-ray or does the MRI. They need to communicate. The pharmacy dispensing systems need to communicate. There are so many. Nurse call system needs to communicate. So that's where the need for the interfacing. So historically, we have been using this standard, what called HL7, health levels, which is a messaging standard to exchange information between systems. And that has worked well. And of late, maybe 7-8 years ago, they came up with FHIR standard, a little bit more than actually, which actually modernized the HL7. So you can XML into that and communicate even at a deeper level than the HL7 could do. So these developments have happened. The challenge remains, it's the interoperability not within the confines of a healthcare system, but the industry or in the country or in the state. So organizations that are using Epic, they can communicate easily with each other. Epic has a product care everywhere. So if you are a patient in, say, county of Santa Clara, where I am right now, and you go to Kaiser, and Kaiser uses Epic. And if I go to Kaiser in my hometown, the message, my chart can flow over there because Epic provides that. Yep. The challenge is the small and medium scale organizations who do not have Epic or who have Cerner. Even for them, there are some solutions available, but not everybody has fully adopted that. For example, there is this industry standard, which is both standard and also a set of tools. It's called Care Quality. Somebody subscribes to the Care Quality. They actually bring all the EMRs and organizations talking with each other. So a Bearwell system, they will not be using Epic. They'll be using something else, but their data can flow into the Epic system, even for us or any other organization, and that can use the Care Quality. And there are a few other tools available. But of late, I think it was 2023, there was new federal regulation, the Cures Act, that required, I think the name of the regulation was information blocking,
Mm-hmm.
that no organization can block the healthcare data to be given to an entity that's requesting it
Mm-hmm.
confines of HIPAA rules. HIPAA is the
Yeah.
patient privacy rule, or even the patient asked it. So at that time, there were some accelerated efforts to make sure that your system can actually produce data that could be consumed directly by the patient or some other entity. But there's still a lot of work that needs to happen, and it continues on.
Yeah, right. So we are in mid of 2025. So what is the vision of this year or maybe next year? What do you see new inventions coming up, and what are the few massive innovations you are deploying in a couple of months or next year?
Yeah, there is there's a lot that is happening, and buzz is around the AI.
Mm-hmm.
And every organization is working on automating their processes, bringing in efficiencies where possible through AI. I was talking about some of the major challenges I have: limited resources, provider burnout, and if we can address those with technology. So one thing is that is growing exponentially these days is the ambient clinical voice, or people call it technology or voice technology. Essentially, what is doing that enabling the care providers to take away their fingers
Mm-hmm.
from the keyboard and start talking into some device. The device could be phone or your computer or whatever device that can capture the voice. So in coming days, we are also on that journey. We are going to implement ambient voice in our organization. What it's going to do is that it'll enable providers to talk with patients, so give more face time to the patient and less time to the computer.
Mm-hmm.
And this technology will take care of typing all the notes and conversation into the system. So many organizations have already done it. We are also on the journey, and that is going to improve many things significantly. One of them is documentation. The other one is taking the burden from the providers that they have a little bit of quality time in the evening. Generally, with the advent of EMRs, one of the downside is that the providers have been impacted the worst because it less and less quality time at home with their families. When they go home, they continue to take care of the EMR, complete the documentation, close the encounters and whatnot.
Yeah, it's pretty interesting. So let's see, by next 6 months, you're an expert in delivering things quickly. So I'm hoping by this year, all these things will be already in place. Other than your full-time CIO work, you are also very, very active. You are an author. You are socially active in teaching people, spreading awareness across. Tell me more about the age of inclusions. And there's another book which is coming up or you have already launched. We'll be happy to know more about it.
Yeah, thank you for asking that. I believe everybody has different hobbies and motivations and how they keep themselves excited and engaged. Because if you do the same thing over and over again, you're a little bit boring, right? Most of my career, I worked as a consultant and I had the opportunity to work on different and challenging projects. So I learned a lot in this process. I've been lucky in many ways, been able to work with great teams, leading great teams, and working on some of the challenging projects. So in that regard, I feel obligated to share my experiences with the world. That is my effort on being active on the social media, especially on the LinkedIn. If I know something, why don't I share so others can benefit from that? We all learn from each other. And these days, social media is providing that opportunity. Regarding the book, Age of Inclusion, that is written about the 5 different ages at some point that we had in work. They are shrinking now. Generally speaking, we have 4 ages, but in near future, we can, once the Gen Z start coming into the work, we'll have one more time 5 generations in work. And each of them is very unique. What, as a leader, when I step in, I just don't have to log in my computer and make sure that data center is running. I am a people-centered leader. For me, my biggest and most important asset is the people that work with me and that I have honor to lead and privilege to lead. I have to make sure that I understand that who they are, what they want to do, how they want to do that, what motivates them. in order to, one has to get a little bit deeper and out of their technology bubble to understand humans at the basic level. So I started doing the research that what are some of the challenges, because everybody complains that I'm also father of two Gen Z boys. And I dedicated a book to them too, because every day they teach me something, I'm some old ancient being that doesn't understand where they're coming from, what their challenges are. And I'm telling them that I lived through this. So, 30 years ago, maybe I was a cool boy like you guys. Not anymore, because I have to focus to make sure that you enjoy the things that you are enjoying so I can focus more seriously on my work. So that was a great learning experience. I hope that my book actually provides some value to the readers. But I have two fields and two passions. Mm-hmm. One of them is the leadership itself. Mm-hmm. And then there's the technology. At the core, I am a technologist. I went to engineering school. I went to get another degree in computer science. Then I got my degree in business. So I had interest both in technology and in business, like in the business side of the things. So with that lens, I'm torn between what I do. So my first book was on the leadership, but my second book is going to be on the AI, but not from the lens of a technologist, that how the elements work, what are the agents, how to write agents. There are a lot of brilliant people than me that take care of that. My job is to make sure that whatever technology is being developed now has a connection with the real world, which is that it could be operationalized, not like theorized or from theory to create something that you can use, right? So from that end, there is a huge need of upskilling, especially at the decision makers level, CXOs as we call them. And that knowledge is lacking. People at that level are so afraid of AI. Mm-hmm. It has some opportunities where it can go wrong, but generally it has a promise and it's going to deliver. But the thing is that we have to make it simple for people to understand. So my book is going to come from that side to educate and inform the C-level leaders that this beast that everybody is talking about and how it can solve some of your problems. So I'm kind of 80% done with that and working with the publisher to bring it out. So now it's going to be in the hands of publisher that when they publish. And
is it like wisdom at work? Are you talking about that? Or you are?
Is a name that I use. I say leading with wisdom.
Okay.
Leading with wisdom in the age of AI. Okay. So AI is artificial intelligence, right? There's intelligence. Intelligence is the human, intelligence in the machine. Now we introduce this artificial layer. But what's going to make us survive is our own wisdom, not the artificial word in intelligence.
Right.
That I use this term, and sometimes you might read on LinkedIn too. And this is where the wisdom comes in. And that's where I use this like my brand. I was saying that there's this old saying that knowing tomato is a fruit is a knowledge. Not putting it into fruit salad is wisdom. So that's where the difference is. And that is the same thing that is happening with AI. That AI is everywhere and AI could be a tomato. And that's there. And this is a fruit. This is a solution. Why I should not put everywhere? So the wisdom comes that, yes, this is a tremendous technology. It has a lot of promise. But your wisdom comes from where you're going to use it. If you cut your tomato and put it into the fruit salad, I hope nobody's going to eat that. Even though separately they have their own value. Fruit salad, something I love. A tomato, I love when it's cooked or somewhere else. It doesn't belong to the fruit salad. So taking that analogy is actually the gist of that book, that yes, we have this powerful tool at our hands. How we utilize that. And that's where the human wisdom is going to be very important.
Yeah, amazing. It seems to be very, very interesting. So do let us know as it is launched. I'll be the, happiest one to grab an order, or if you have pre-ordering, I'll do that as well. And I'm pretty interested in reading about your older book as well, The Age of Inclusion. Seems to be very, very interesting. And I'm pretty sure our viewers will definitely go ahead and even have a look and see what is this book all about. You have already given a good description about it. Very exciting. So thank you so much, Khalid. It was wonderful talking to you. And before we leave, what is the one thing would you like to tell to any of the CIOs, especially from the healthcare sector?
Yeah. I think this is something that I tell to everybody at the work level. It's not people who are starting and people who have been there in their mid of careers are those who are gotten to the top. That don't let your title define you. You are much more than that. And your job description is not what you were hired for. You're hired for a professional who should be able to do anything that's needed of them. Especially for the younger generation, if you want to grow in your careers, don't let your job description define you. Yeah. Bring value every day. Bring every skill you have, every knowledge you have, and see what value you can generate. And then you will see how well you get noticed and how the opportunities keep coming your way and more doors will open.
Great, great. I loved it. So, love the statement that do not let your job description or designation define your skills. You can do much more and a lot than that. Thank you so much, Khalid. Thanks a lot for sharing all the incredible insights from micro decisions to macro strategy. You have given us the rare look and really appreciate your time. Thanks.
You're so welcome. It was a pleasure talking with you. And thank you for asking those great questions.